me talk about this. You wake up this morning with chronic pain. Maybe you've got back pain. Maybe throughout your day you got to deal with it. Are you on medication for it? There's a number of ways. Chronic pain can affect your life not just physically, but emotionally. I think we've touched on that before. It's good to reiterate, though. I think, and joining us now, an expert in emotional issues, of course, because he's Dr. John Braccio, Regional Psychological Services, and our What's Up, Doc segment. Hey, Doc, what's up?
Well, good morning to you, and really the emotional wasteland of chronic pain. Okay, when we have talked some about chronic pain in the past, and it's really worthwhile talking about every now and then, because the devastation it can cause to a person emotionally, really, it's not just to themselves, but also it can impact those around them, because chronic pain really does cause just this emotional wasteland for the person. They often over time develop some combination of anxiety, depression, anger, inability to handle their emotions, problems interacting with others, isolation, lack of physical movement, in a life that really can seem hopeless. And unfortunately, suicide ideation is too common, actually. And chronic pain is generally considered a condition that lasts over 3 months and doesn't go away. Think about that for a minute. We all have injuries and operations at times that can lead to having pain. But Mike, we know the pain's going to eventually go away. Well, the person with chronic pain not only has pain every day, but they know it's going to continue. It can be the result of nerve damage, problems with disc and other issues with the back, arthritis, fibromyalgia, sciatica, headaches, back pain, and other conditions that bring constant pain to the person that doesn't go away. Now, in 2021, the Centers for Disease Control and Prevention, CDC, said a study found that 20.9% or 51.6 million citizens in the United States experience chronic pain on a yearly basis. I think those are just amazing numbers when you really think about it.
Wow, yeah.
You have 51 million in a year. It shows this is a condition that is very common for millions of persons. Persons often don't talk about this with others because, generally if you ask someone how they are, they're not going to say, well, my back's been hurting for 7 months. They don't, okay. They may do it with close family, but they really don't. And there can be help, too. People can get help with medical interventions that can do things like there's pain medication, occupational therapy, physical therapy, psychological support, spinal cord stimulator, pain pump. But the problem is a lot of times all of these don't really take care of it for the person, and the pain still continues, okay? And I always encourage people, there are things that can be helpful. Like one reason I'm very sensitized is I and members of my office, for years we've dealt with doing evaluations for those that get spinal cord stimulators and pain pumps. So talking to people with chronic pain is really quite typical. And really, if you do, you really see people that have just been really devastated, overwhelmed by the pain. When you're getting pain 24/7, it can be pretty overwhelmed. And if you're around persons, be aware they can be negative. They can be chronic, they can just crotchety. They can be difficult because of this pain that they're in. A lot of times they don't move much. They're isolated. And if you're around, you want to try to be helpful. You don't want to get in there and say, yeah, you really ought to keep sitting down. I wouldn't try to get up either. You really want to encourage people to do as much as they can because the body does need to move. And a lot of times one of the problems with that is a person with chronic pain, the walking can be very difficult, very limited. So I just encourage people, and I would do the same if you're around a person with chronic pain, just to encourage them to do as much as they can. That really becomes pretty important for the person to be able to move as best they can, and just be tuned into them. Learn as much as you can about the chronic pain. And I think if you do and you try to help people and try to be helpful, it's one of those things that's the type of compassion that you have it for the person with chronic pain, and it's a form of love and can be helpful to you as well as the person with it. But it's a tough condition to have. It really is. If you have it, it can be overwhelming to you, overwhelming to those around you. And there are enough persons that have anxiety and depression and just difficulties walking the road of life. When you add on top of that chronic pain day in and day out, that can go to really pretty high levels. It can be just overwhelming for the person. So we just have to be aware it's out there, be aware we're talking about 50 million people in 2021. And well, if you think about it, people if you think about it, I'm sure you know people that have chronic pain, bad backs, that horrible migraine, headaches, just situations, sciatica, things that just really don't go away. So we have to just try to be helpful and supportive as best we can.
Chronic pain it's more prevalent than we realize. Like you mentioned it in your early on, if you run into somebody who's a real Scrooge this time of year, right? Watch how they walk, because generally they're humped over or they're limping or something, and I've never made the connection between, pain. If somebody have chronic pain, it's like, well, okay, get some medication or, stretch or do whatever you're supposed to do. Drink some water, take an aspirin. But boy, and the people with the pain don't even realize it, probably, do they? That's affecting their emotional stability, the pain?
Well, I think they often do, but it's something they can't it overwhelms them. Like if you're around chronic pain people, and I am, you really do see it's overwhelming. And a lot of times they're isolated. They don't want to see people. And just to walk, I just talked to a woman that even walking to the mailbox and back gets to the point that she needs to sit down, needs to. And well, that's more common than you might think. Because remember, a lot of times people with constant pain, they're not out and about either because they're inside. They're often not able to drive cars, and they don't see people. And because they're kind of in bad mood or struggling, or they're just kind of private, they don't want to be, just always talking about it. But if you're always in pain, it's hard not to have that be a topic, of discussion.
Yeah.
So I think that if we do run into people, and we are, even if we're not aware of it, because I'm sure Chuck and Chucky or your parents or friends.
Lisa's dad. My wife's dad just moved in with us, Doc. And
okay.
The guy, God love him, 88 years old. I had this conversation with my daughters over this past weekend because, things can, when you have someone new in the house that's going to live there and need maybe a little help, it can get draining on everybody. So, I had a little private talk with him. I said, think about Papa. Here's a guy who's lived 88 years on this planet. He's a veteran. He's paid his dues. He raised a family successfully. He buried a wife. And now, independent man, right? Right, a man from back in the day. Independent, now he can't be. Think about just that. Because I don't think he has a lot of pain, really. But just sometimes, and he's a genuinely gentle, nice guy. But you got to give him as much slack as you can, because suddenly he's dependent and is admitting so on other people.
And that's hard.
Oh, my.
That's very hard. But Mike, listen, I applaud you. I think you and your wife and the children, I think that's a wonderful thing. And there's a lot of that, just a lot of, and even if he's not a lot of pain, obviously he's not able to get around and basically needs help. And really, you're offering him that support, like remembering all the people he helped in his life. And now it's, you're doing the same thing. So I think being sensitive and understanding how these things happen. And as people live longer, obviously, the carriage wears out more. And they basically it can lead to more of the joint pain, the arthritis, and the migraines can be with people for a whole lifetime. So I think being tuned in and trying to be helpful and recognizing how debilitating it can be. And again, Mike, imagine getting up every day and having this pain. You always feel bad. And you can take medications. You can do a lot of things. PT, there are things that can be helpful for you, but it doesn't take it away. And that could be very, very difficult. And if you have, scoliosis, things with your neck, your back, and a lot of times you can't have operations on it. And you may be, epidurals, rhizotomies, shots, and things that you're getting to take away the pain. And it may help for a while, but a lot of times it just goes right back. And so there you are, so it's, and that's why there are things like, I say, spinal cord stimulators, pain pumps, things people do. But overall, it's just a difficult situation, and they need help and support. And a lot of that comes from our being helpful and supportive to them if we're close to them, and realizing they may be a little irritable, whatever it might be. But just try to put yourself in their shoes. It's a pretty tough situation, buddy.
Dr. John Braccio, Regional Psychological Services. Every week we get some good information for you, Doc, for free, and we appreciate it. Chronic pain, just be aware of those around you. Maybe they're Scroogey because they got pain. All right, thanks, Doc. We appreciate it.
Always a pleasure talking to you, my friend. Bye-bye.
Bye now. 1320 WILS. Evan Brown's up next. Daniel Penny, not guilty. We'll get into it. Hang on.